Hi, everyone. I'm Dr. Adam Zweig, and I am the Medical Director of the ViiV Healthcare Foundation office in San Diego. We're here for Ask Me Anything About CABENUVA. Follow me inside, and we'll talk.
CABENUVA is for virologically suppressed adults and adolescents with HIV-1 who meet certain requirements. See full indication on screen. It is contraindicated in patients with a previous hypersensitivity reaction to cabotegravir or rilpivirine and in patients receiving the medications listed here. Please watch the entire video for additional important safety information. Please click the link to view the prescribing information for CABENUVA.
Thanks again for joining me. Let's go ahead and get to the first question. What is CABENUVA and how does it work? CABENUVA is the first and currently only complete long-acting regimen for the treatment of HIV infection in people who are suppressed. CABENUVA consists of two different medications. They are in separate syringes, but given at the same time. The first medication is called cabotegravir. Cabotegravir is in a class of antiretrovirals called integrase strand transfer inhibitors. The second medication is called rilpivirine. Rilpivirine is in a class of meds called NNRTIs, or non-nucleoside reverse transcriptase inhibitors. Both of these medications interfere with the HIV replication cycle in two different spots. I've been prescribing CABENUVA ever since it became available. It was first available in a 1-month dosing schedule. Soon after that, a 2-month option became available. Please see the dosing schedule on the screen. The medication must be given by a healthcare professional. But I want to make it clear this doesn't have to be the provider or the RN. It can be the LVN, or it can even be a medical assistant who has been trained to do so. Okay, let's go ahead and move on to the next question. What does CABENUVA mean to you and your practice? As an HIV provider, I think we owe it to our patients to achieve and maintain viral suppression and reap all the health benefits associated with that. Most of my patients that have switched to CABENUVA don't want to go back to an oral regimen. Subscribe to the Ask Me Anything About CABENUVA series on YouTube to hear from experts.
Warnings and precautions. Hypersensitivity reactions. Serious or severe hypersensitivity reactions, including Stevens-Johnson syndrome, toxic epidermal necrolysis, and drug reaction with eosinophilia and systemic symptoms, or DRESS, have been reported with CABENUVA or its components. Some skin reactions were accompanied by symptoms such as fever. Other skin reactions were associated with organ dysfunctions. Oral lead-in may be administered prior to administration of CABENUVA to help identify patients who may be at risk for a hypersensitivity reaction. If a hypersensitivity reaction is suspected, CABENUVA should be discontinued immediately and the patient should be monitored. Post-injection reactions. In clinical trials, serious post-injection reactions, such as those shown here, were reported in less than 1% of subjects within minutes after the injection of rilpivirine. These events may have been a result of accidental IV administration and began to resolve within a few minutes after the injection. It is important to carefully follow the instructions for use and observe patients for approximately 10 minutes after the injection. If a post-injection reaction occurs, monitor and treat as clinically indicated. Hepatotoxicity. Hepatic adverse events have been reported in patients receiving cabotegravir or rilpivirine with or without pre-existing hepatic disease or identifiable risk factors. Patients with underlying liver disease prior to treatment may be at increased risk with CABENUVA. Hepatic monitoring is recommended and discontinue if hepatotoxicity is suspected. Depressive disorders. Depressive disorders have been reported with CABENUVA or the individual components. Promptly evaluate patients with depressive symptoms. Risk of adverse reactions or loss of virologic response due to drug interactions. Adverse reactions or loss of virologic response due to drug interactions with concomitant use of CABENUVA may occur. Use with caution in combination with drugs with a known risk of torsade de Parr. Long-acting properties and potential associated risks with CABENUVA. Residual cabotegravir and rilpivirine concentrations may remain in the systemic circulation for up to 12 months or longer. Non-adherence to injections could lead to loss of virologic response and development of resistance. It is important to initiate a fully suppressive regimen no later than 1 month after the final injection doses of CABENUVA when dosed once monthly, and no later than 2 months after the final injections of CABENUVA when dosed every 2 months. If virologic failure is suspected, switch the patient to an alternative regimen as soon as possible. Adverse reactions. The most common adverse drug reactions were injection site reactions, pyrexia, fatigue, headache, and those listed here. Drug interactions. For important drug interaction information, refer to the full prescribing information for CABENUVA, Flocabria for oral cabotegravir, and Edurant for oral rilpivirine. It is not recommended to co-administer CABENUVA with other antiretrovirals. Drugs that are strong inducers of UGT1A1 or UGT1A9 are expected to decrease the plasma concentrations of cabotegravir. Drugs that induce or inhibit CYP3A may affect the plasma concentrations of rilpivirine. Use in specific populations. Assess the potential risks of using CABENUVA during conception, pregnancy, and while breastfeeding. Please click the link to view the full prescribing information for CABENUVA.